Good afternoon to everyone. Today I deliver the topic is Myocardial Infarction. Myself Varalakshmi K, Nursing Tutor, E.S College of Nursing, V. Definition: Myocardial infarction is defined as a disease condition which is caused by reduced blood flow in a coronary artery due to atherosclerosis and occlusion of an artery by an embolus or thrombus. MI or heart attack is the irreversible damage of myocardial tissues caused by prolonged ischemia or hypoxia. According to anatomic region, left of ventricle involved anterior, posterior, lateral, septal, circumferential. Combinations: anterolateral, posterolateral, anteroseptal. According to degree of thickness of ventricular wall involved is transmural and laminar. According to age of infarcts, newly formed, acute, recent or fresh, advanced infarcts, old, healed or organized. Epidemiology: in industrial countries, MI accounts for 10 to 25% of all deaths. Incidence is higher in elderly people, about 5%, occurs at people under age of 40. Males have higher risk. Women during reproductive period have low risk. In 2006, studies revealed a prediction that India would account for 40 to 60% of cardiovascular disease burden within next 10 to 15 years. Over last 30 years, the rate of diseases increased just from 2 to 6% in rural population and 4 to 12% in urban population. Etiology: obesity, stress, alcohol, tobacco smoking, hypertension, drug abuse, diabetes, family history of ischemic heart disease, chronic kidney disease. Pathophysiology: due to etiological factor that leads to atherosclerosis formation, that leads to obstruction will be there in the heart, that leads to ischemia, inadequate blood supply to the tissues, that's why reduced oxygen demand, that leads to permanent thrombus, that will leads to myocardial infarction. Clinical manifestation: chest pain, chest discomfort, dyspnea, fatigue. Other symptoms include increased sweating, weakness, nausea, vomiting, lightheadedness, palpitation, anxiety, sleeplessness, hypertension or hypotension, arrhythmia. Chest pain is less in women. Their common symptoms are weakness, fatigue and dyspnea. Diagnosis: history collection, family history of ischemic heart disease or any diet history in individual, history of any alcohol taking, tobacco chewing. Clinical features: pain, indigestion, low-grade fever. Serum cardiac markers: creatinine, phosphokinase, lactic dehydrogenase, cardiac specific troponins. Segment elevation, T-valve invasion, appearance of wide deep Q waves, magnetic resonance imaging study, chest X-ray, angiography, positron emission tomography. These are all the investigation for myocardial infarction. Management: pharmacological management, thrombolytic agent, tablets, streptokinase to improve the blood circulation into the particular part, anticoagulant, heparin, antiplatelet agent, clopidogrel, antihypertensive agent, ACBE inhibitors, lipid-lowering drugs, statin tablet, atorvastatin, vasodilators, nifedipine, others, analgesic, anti-ulcer drugs, antidepressants. Treatment algorithm for MI. Myocardial infarction: pre-hospital, on arrival, GTN spray, oxygen, pain relief, admission to hospital, aspirin, thrombolytic during hospital admission. Beta blocker, ACE inhibitor, insulin, consider revascularization, angioplasty, stenting, arterial bypass. Long-term rehabilitation: aspirin, beta blockers, ACE inhibitor, statins. Surgical management: percutaneous transmural coronary angioplasty. Coronary angioplasty to create the opening into the blood vessels to improve the blood flow to the heart. Stent placement to remove the plaque. Coronary artery bypass grafting. Complication: cardiogenic shock, congestive heart failure, thrombus embolism, rupture, cardiac aneurysm, pericarditis. Thank you.